for the Bureau of Public Health and and USAID. So she's been in the field for 10 plus years and really excited to learn from her. When she was at Pitt, she did the study abroad program in Tanzania and she learned some Swahili. So she got the certificate in African studies. So I'm just excited to hear how her career has advanced. So, Caitlin.
Sure. And I think we just have we have the hour, and I'm very happy to leave some time at the end for questions from you all. So have those in mind as I talk. Let me close the door real quick. Working from home. I'll be right back. Okay. All right. So Caitlin Thistle. So my current role, I'm actually working with USAID Washington. I'm calling in from Rockville, Maryland. My title is Senior Advisor for Southern Africa. And so what that means is I'm in the Office of Country Support within the Bureau for Global Health. So USAID has folks based in Washington and they have folks based in the field at missions. And so I'm here in Washington. The Bureau for Global Health is 800 or 900 people. And then the office that I'm in is the Office of Country Support. And the purpose of the office is to support our colleagues out in the field, to be that bridge between Washington and missions. Sometimes, you can hear from USAID folks out in missions that sometimes they might feel disconnected from like what's happening in Washington, what's happening in Congress. So part of our role is to facilitate those communications. Oh, it's so good to have you, Marina. Welcome, or Dr. Lele. So good to see you.
It's good to see you, Caitlin.
So I just got started. So you didn't miss anything.
Wonderful. I'm so proud of you, everything you've accomplished, and I'm happy to be here to listen.
No, and I'm happy to be here because my experience at Pitt was absolutely formative in where I am right now.
Wonderful.
So yeah, happy to be here.
That's our joy.
Yeah. So, okay. So I work, okay. So that's my current role. And so I kind of backstop our missions in Southern Africa. And specifically, I have a particular role with USAID Zambia and USAID Madagascar. And then I'm a kind of a POC back in Washington for every other country in Southern Africa. So a bit about my path. So I was a student at Pitt who came straight from undergrad. I really didn't have much exposure. Well, let me rephrase that. So in undergrad, I had an international internship experience in Uganda, and that opened my eyes to this whole world of international development and public health that I did not have previously, that there's this whole kind of industry. So that led me to apply to grad school, and I went straight to Pitt from the Susquehanna, which is where I went to undergrad. So I got a master's in international development. And that is really like a generalist degree. You have classes in policy, how to write concise policy, like action memos, which is very helpful. I had a class on gender, statistics. I mean, it was a very helpful degree. What I realized when I was at Pitt, whenever I had an opportunity to write or research a topic, it was a topic that was related to public health. So near the end of my time at Pitt, I was like, oh, I could have gotten an NPH. But it's actually worked out well, because there have been times when it has been to my advantage that I don't have an NPH. I'm kind of surrounded by people who have masters of public health. And so I bring a different perspective, and that kind of diversity and background is seen as a value. But while I was at Pitt, I remember somebody saying to me, if you have a master's of international development and you graduate from Pittsburgh without another language, you will be jobless. It was somebody at University of Pittsburgh who said that. And I was like, oh, wow, that was like a really helpful, like slap in the face. Like I didn't have a language. So I chose Swahili because of my experience in Uganda. So when I came out with my master's, I went straight to Tanzania, back to Tanzania, and was a site director for programs for Amazaji. You all might know that organization. It's based in Pittsburgh, called Amazaji. And so for a year with my husband, we got married. He had never been to Africa before, and we took a year-long contract in rural Tanzania. So not like the Tanzania where you can get by with English, right? So it was a really good test run for the Swahili that I had studied at Pitt. And I became, conversational. So, and then I wanted to come back to DC, and I'm like, I'm cool, right? I got my master's. I have a foreign language. I've done all the things that people told me I needed to do. And I struggled. I was unemployed for like 6 to 8 months. I got little consultancies here and there, but, and I struggled because I didn't have the networks in DC, and I didn't have the knowledge about, how things work, how USAID really works. So my one piece of advice would be, one thing that I learned from that experience is I spent too much time just on my computer, applying for jobs cold. And when things started really moving for me is when I was doing informational interviews. I started reaching out to like everybody I knew, having those coffee chats. And that's not helpful just for like, okay, where should I be looking for jobs? But also just like how things work, what is the system? So that's one thing that I wish I knew, and I had done differently, is focus more of my job searching time on making connections with people, and that includes like cold connecting with people on LinkedIn. I mean, this is how things work. So I think people are very open. Alumni of Pittsburgh in particular are very open to talking to current students, recent graduates, because we were all there at one point, and we all can say that, maybe not all of us, but a lot of us can say that an alumni helped us along the way, right? So, alumni want to give back. So that kind of informed my path. I had a master's degree. I had the language. I had the experience in a developing country. And then the job that I landed was a program assistant. So that's like, very entry level, taking notes, making copies, administrative tasks. And I think it's safe to say I was an overqualified program assistant. But what it did is it got me in USAID. And so, what I found from interviewing at different jobs was everybody wanted me to know like USAID rules and regulations and policies and how, and I didn't know any of that. So starting as a program assistant helped me like start to soak in all of that information while I, did all those tasks. So I think, that's a big lesson learned, is even if the development industry is so oversaturated with people who are mission oriented, they want to do the work. There's a lot more people than there are jobs. So what that means is oftentimes when you come out of school, you know, even if you have really good internships, which I had, you got to start from the bottom and work your way up. Like that was my experience. And maybe that was part of my experience because I feel like I lacked like any like real, I know that people take, you know, they don't like this language of hard and soft skills, but I didn't have like, if you come out and you're like an M&E person, like that gives you like, that's a track that you can be on, or statistics, like that's a track that you can be on. So I didn't have any of those hard skills. So that's why I feel that also was a variable in me, like starting entry level and working my way up. So I actually started in the Office of General Counsel, and that's where the attorneys are. But I was backstopping, supporting the attorneys that work on global health. So then I was like, okay, I want to get closer to the programs. I want to get closer to, you know, how we actually use our funds to do work. So I moved into the Bureau for Global Health, into the Office of Population and Reproductive Health. So for 6 or 7 years, I worked on family planning and reproductive health. And just recently, just last year, I moved over to the Office of Country Support. So our technical offices, I mean, one thing to know is that USAID's budget and funding, a lot of it, maybe the majority of it is health. And that is largely driven by PEPFAR, the President's Emergency Plan for AIDS Relief, right? And it was passed by President Bush, biggest bilateral donation by any country ever in the history of the world for one disease. So PEPFAR continues to be the big bulk of health and a big piece of USAID work. So after PEPFAR, in terms of budgeting, comes the President's Malaria Initiative. And we work on the issues that drive mortality and morbidity in developing countries. And it all comes from Congress. Congress decides our budget. And so it's HIV/AIDS, it's malaria, and it all comes in these health program areas. But then there's also family planning and reproductive health, maternal and child health, infectious diseases, under which there's tuberculosis work, polio work, and something is on the horizon. The thing that is on the horizon is, of course, COVID has really been a huge shift for the world and for us. We've gotten a lot of COVID supplemental funds, and that has led to creating new units, creating new processes for getting this money out to missions to get it to the programs. So what's on the horizon is more work around pandemic preparedness, so that when the COVID is not the last pandemic, it's not the last infectious disease that is going to rear its ugly head, right? It's in a long line of other diseases that have emerged that we've had to respond to, such as like Ebola, avian flu. So there's going to be more resources around pandemic preparedness. So anyway, that's a little bit of like my journey. I started from the bottom, and then I just kind of worked my way up. And now where I'm at is, you know, it takes a lot of time to understand how USAID works. It's a big bureaucracy. It's a lot of processes. So the niche that I have found myself in is now I have a really good understanding of how to navigate this bureaucracy, but then also how missions work, because that's a big, you know, and maybe that's a good segue for me to talk a little bit about. So Congress gives us our funds. Some of those funds go to USAID Washington. A lot of those funds, the bulk of them, go directly to our missions. So, and when I say missions, missions are under Chief of Mission Authority. They're connected to the embassy. So we've got, a mission in Kenya, a mission in, South Africa. We have missions in most, certainly most African countries. A lot of our funding for public health within USAID has shifted from Latin America and the Caribbean to Africa. So I think that's a really important note for students, is how things have shifted. Alex, you mentioned your French major. French is huge. When I came out and I was job searching, very few jobs require Swahili. Lots of jobs require French. So I was feeling like, maybe Swahili is the most widely spoken African language. And I feel really proud that, that's the language I chose. But when you get to the job market, French is really important. So I think it's important for people to know about the shift from Latin America and the Caribbean to Africa, because that should inform the language skills, right? So Spanish is not nearly as highly needed. It's really about French because of Francophone West Africa. But then also, a little bit of Portuguese, like that's Angola and Mozambique. And one or two of the island countries. But anyway, that shift is really important for folks. Like Africa is really, really important for like USAID, international development, and certainly for public health. So I was talking a little bit about how funding works. So a lot of it goes to missions. And then USAID, it's important to note, we're a donor, we're a funder. So largely, we don't do the work. Who does the work is who we call implementing partners. And in public health, there's a lot of really big ones. FHI 360, GSPIA in Baltimore, Apt Associates. And certainly there is an increased effort right now for localization, for getting more of our resources to local partners, organizations that are based in, the places in which we work. But it's important to know that we're not doing this work. We are giving the money. What we do is we create requests for proposals, and then we put it out on the street, as they say, and organizations put together proposals to say, we have the best plan for implementing the work that you want done and getting you the results that you're interested in. So USAID drives, what are the strategic objectives that we want to see? What are the results that we want to see in 5 years? And then we put it out on the street, and partners tell us that they can do it. We go through a procurement process, which is very, sensitive, it's very procurement sensitive. And then an organization wins, and we give it to them for 5 years. Typically, there's different kinds of awards, but for public health, it's typically 5 years. And then we kind of manage with the partner. We have deliverables, like annual reports. It's a big reporting burden for these organizations to get USAID funds. So that was a lot. But that's a little bit of people, I want you to help you understand how international development, at least USAID funded international development, works. So it's driven by implementing partners. So what that means is you could work for USAID, but you could also work for an implementing partner and actually be doing the work in any of these areas within public health. So I mentioned, the health streams, HIV, malaria, and the others. It's also important to know that there's cross-cutting themes. Youth is huge, like the youth bulge in Africa. A lot of the African countries, the percentage of the population that is, younger than 35 is the large majority of the population. So understanding how to target programming for youth and get data that will help us target programming is important. Gender is really, really important, and it's getting more attention and resources with this administration. So gender is an important cross-cutting issue. Capacity building, kind of localization is also an area. So yeah, that's a bit about USAID and about public health. I wonder if there's any questions, I'm happy to answer them.
We'll see if students have questions. I have a question too. So if any of you guys have a burning question, or not even a burning question, just a curiosity.
Yeah, I'm happy to answer anything. And I'm looking, Anna Marie, at your
students feel free to put it in the chat too. We're always welcome to do both.
I'm curious, Caitlin, just like about what does your job really entail? Like, what is your daily, like, what are you doing? You know, like on a day, like, what skills are you using? Are you writing emails all day? Are you sitting in Congress? Like, what kind of things are you doing? How many trips are you taking to Southern Africa? Are you talking to locals? Like, what kind of skills are you using on a daily basis?
Yeah, so I'll answer that. And just to say, I dropped in the chat box a couple of key resources that I thought were important to share in this chat. The first is a USAID webpage with different internships, and that's across USAID. That's not just for global health. And then the second piece is the different hiring mechanisms within global health. So it provides a good overview. I mean, one thing that's important to note is I actually don't have a direct employment relationship with USAID. I work on a hiring kind of mechanism. So I'm an institutional support contractor, is what they call me. So if you click on that second link, you can see the Global Health Support Initiative. That's what I'm on. So it's really kind of odd, like my employer, their name is Cameras, but I have a USAID email. I work within USAID. Sometimes it's very hard to distinguish who's a contractor and who's not. So anyway, those are like really key resources. So that was like huge for me when I was unemployed. I was only looking at usajobs.gov and thinking that was the only way to work at USAID. And that's not true, right? There's tons of contractors, and global health is actually 2/3 of the staff working on global health in USAID are contractors working on one of these contracts. Okay, so now I'll answer your question. What am I doing on the daily? Ever since March 2020, we've been working from home. I actually had a trip to go to Mozambique. I had my flight. I was ready to board back in 2020. And I was going out with a senior like public health colleague of mine. And he was watching COVID. He's like, Caitlin, I think this is a lot bigger than we realize, right? So of course that trip was canceled, and we tried to do what we could virtually. But anyway, I've been working from home. We're still working from home. USAID, the future of work, they've announced we're going back May 23rd. So we haven't been back to the office yet, at least in a mandated way. People have gone back voluntarily. I've gone in for a couple of IT issues, but so my routine is working from home. But what are the skills that I use? So in terms of travel, my position description says up to 30% travel, which is a lot. And, I've got 2 kids under 5 years old. They made sure to ask that question in my interview, like, how much travel can you really do? And so, the expectation is that I travel fairly often. I was just in Zambia in February for 3 weeks. And it was my first time being in Lusaka for USAID. So that was really good. So travel is a big part of my job. But yeah, what do I do? I mean, I work on a computer. It's a lot of like sending emails. I'll tell you, it's all about relationships. So I have a mentor who was one of the first foreign service officers, health foreign service officers for USAID. And he was in Congo when they first identified and named Ebola. So anyway, he's retired now. That was back in like the 70s. He's retired now, but I'll never forget something that he told me, and he's told hundreds of people. You know, real estate is all about location, location, location. Working at USAID and in international development in general, it's all about relationships, relationships, relationships. So it's a lot of like, just this morning, I had 2 like little coffee chats, you know, like, and there, it's actually really important, like how the work gets done. So being able to make small talk and to make connections with anybody that you come across is really important. And that's not how really I was brought up. Like, I was brought up that like, we didn't highly value like making connections with people. And so it's been a learning curve for me at USAID to realize it's not just about the work. It's not just about the results. I mean, in order to get the work done, you have to build those relationships. So I think that's a really key lesson that, you know, it would have been good for me to know like earlier, but that the interpersonal skills are everything. So I talked about the hard skills, but you will not be effective without those soft skills of like emotional intelligence and communication. And so any like training or courses or experiences that gets you to use your communication, how do you work well with people, those small group projects that you have at school, like it's really a critical skill set. So yeah, it's a lot of emails and a lot of you know, personal conversations, and it's a lot of like problem solving and decision making. I think I finally come to realize like, yes, like there's a reason why I make pretty good money, and it's because every like problem that comes at me, and it's usually about how to navigate the bureaucracy or how to like get something done, I have to think about, okay, what are my leverage points? Who are the stakeholders that I can reach out to? Who are the people who have the answer that I need, that I can like facilitate, right? So a lot of it is like, should this be an email, or should I pick up the phone and call somebody, or should I like have a 30-minute coffee chat with somebody? It's a lot of that like problem solving and interpersonal stuff. But also, you know, we had somebody, a senior level person, recently retire, and she's going to act associate. So she's going to the implementing partner side. It's like the different sides of the same coin, working with the implementing partners and working with USAID or any other US government agency. And it was inspiring to go to her retirement party, because she was like, people said she never was faced with a problem that she couldn't solve. And if she didn't know the answer, you know, we have like the ADS where all of our policies are written. Having a can-do attitude and saying, you know, Google is your friend. Like, honestly, like there are instances where a colleague of mine, tell you, you know, one story, a colleague of mine got called into a meeting, I think with Administrator Power, like the head honcho of USAID, and was asked about this very specific initiative in Tanzania. And she's the country team, the global health country team lead for Tanzania. She knew nothing about it. She Googled it in like the minute before the meeting started, and she was able to like, you know, at least say something and say, okay, and then I'll go back to people to ask questions to get you more information after that. So just being resourceful and being able to like think on your feet, I think is part of it. Yeah, I'll stop there. What other questions?
Can I ask a question? But I want the students to ask questions first, but I'm going to go ahead and ask, and then please, I hope the students will. So we have the apt associates and the FH 360 or whatever.
FH 360. Mm-hmm.
Yeah. And those folks, chemonics, those groups. Who are the folks that hire you as a contractor? More the administration that's housed within USAID. Maybe you said it and I missed that. But who are those contracting agencies?
Mm-hmm, mm-hmm. Yeah, if you click on that second link that I dropped in the chat, you'll see the three hiring mechanisms that we have right now. And those are led by Public Health Institute.
Okay.
Led by Cameras, that's another one. And another big one is Credence, CREDENCE. So those are the companies that you actually go on their job board and you're actually like applying for jobs to work within USAID.
Okay.
Yeah.
Thank you.
Which link is that, Caitlin? I just see one in the chat.
There's two, or no?
They kind of overlap, but it's the globalhealthtp.org link.
Okay.
I can drop it there again.
Okay, yeah. If you drop it there again, that would be. I see you're right. There are two. Somehow, when I clicked on it, I think I keep hitting the same one. I see we do have a question too in the chat for you.
Mm-hmm.
So this is from Shelby. Even if I plan on working locally, what kind of global health skills could help and benefit me in my day-to-day life as a nurse?
Mm-hmm. Mm-hmm. So Shelby, actually, all of the students who are on at the beginning introduce themselves. I wonder if you can come off mute and introduce yourself, so I know where you're coming from.
Sorry if my voice sounds weird. I'm a little sick today.
Oh, I'm so sorry.
I'm Shelby. I'm a current nursing student. I plan on being a neonatal nurse practitioner in the future.
Cool.
And I'm hoping to grow my skills in that.
Cool. So I actually know a good handful of people who used to work in the Bureau for Global Health who left to go become a nurse. And we actually have a good handful of nurses who work in the Bureau and midwives. So your question, what kind of global health skills could help and benefit as a nurse? I mean, one thing that is a big concept in public health that I think is helpful for, practitioners, clinicians, is to understand the social determinants of health. Social determinants of health. So what makes people sick or what makes people unhealthy that are socially determined, such as race, racism is part of it. But also classism. So what else? I'm kind of blanking, but just this idea that there are lots of determinants, variables that contribute to a person's health status that have nothing to do with medicine. So having that perspective, I think, is really helpful when you have patients in front of you to kind of understand, what was going on in that person's life or in that person's community that led them to be in front of you. Another thing I would say is just an understanding of health systems. So we work on strengthening health systems at USAID. And so that's the big picture. Human resources for health is so nurses are a big part of the health workforce. But also, information and health information systems. How do we use those things to ultimately keep people healthier? So in developing countries, we work on DHIS2. So it's the health information system records, right? How do you, when an individual comes into a clinic, where does their information get entered? And is it electronic? And how is all of that managed? Kind of like the administration of public health, the health system is a big piece of it. So when you're a nurse, like you'll see it firsthand, like it matters, like the records and how you keep track of a patient for their individual outcomes. But public health is more like looking at it at a macro level, but also like, so financing and governance and all of that. Health systems, social determinants of health. Yeah, that's what I'll say. Did that answer your question, Shelby?
Yes, thank you.
Mm-hmm. I wonder if I can ask the other students who haven't yet introduced themselves, Alicia and I'm sorry, is it Heman or Heyman? Could you introduce yourself?
Hello, my name is Alicia and I'm from Bradford campus. And I'm a biology major in pre-med track.
Nice to meet you. Okay. Oh, good. It says you're connecting the audio, so maybe we just couldn't hear you before. You're on mute. There you go.
Hello.
Hi.
My name is Jaemon. I'm also a pre-med student at University of Pittsburgh at Bradford. Yeah.
Very good. It's so interesting. Like sometimes I've done a lot of these, like connecting back with students, and sometimes I get like, it's more like the development, like the government, and they're interested in government and diplomacy and that. But it's interesting that a lot of you are actually working and focusing on health. So the reason why you came was because I work for, not just for USAID, but for global health. Yeah. So anyway, that's helpful for me to know.
And thinking about that, and because a lot of these students are younger in their college, careers, I'm wondering, Caitlin, if you could talk to them, if you could go back to your college career, is there anything that you would change or that you would do differently now, knowing what you do now, that would have prepared you better?
I mean, first
you
and
said like French, like you may have taken French
language. Yeah. First and foremost, I would tell myself to not worry if you don't have a clear idea for what you want to be in 15 years. I've never had a clear idea for what I wanted to be when I grew up. And it's been okay, right? Like I had that little period of 6 to 8 months. It's like nothing in retrospect. But it's okay if you don't know exactly what you want to do. What I have found is, I just kind of go along, and if something, say yes to opportunities that arise so that you can explore. And if you do something, an internship, an experience of volunteering, if you have a relationship with somebody and you don't like it, that's good, because you're learning what you don't want to do. And that's just as important to know as what you do want to do. So it's okay if you don't know exactly what you want to do. I have found that it's nice to be open, because as opportunities kind of arise, like people reach out, I build a relationship with somebody, it keeps me like adaptive and flexible to, the needs that arise. So, I joined USAID. I was a development person. I didn't do anything in health, in Tanzania, actually, after I was with Dr. Lele and those students in Tanzania. They left me in Karagwe, Tanzania, and I worked with WOMEDA, land rights. They were lawyers helping women navigate land rights issues. So I came to USAID and I'm like, oh, all the funding is towards health. And what I was really actually interested in when I was an international development student was, like, girls' secondary education and female genital cutting and, health focused issues. So it was really actually helpful for me to be kind of flexible. Language is something that I would have told myself that, consider, devoting time to learning a language, because it's a way to connect to a whole group of people. I was talking in Zambia, I was with somebody, a woman from Denmark, but she's lived in Geneva, and she knows like 6 or 7 languages. And I'm like, I read Under the Eagle's Shadow or something. And that book was really helpful for me in understanding why a lot of Americans don't know another language. There's lots of reasons, like just our geography, right? So the woman that I was speaking with in Zambia, who's, Danish, she grew up 10 minutes, she drove 10 minutes and she was in France, where you need a whole nother language. And it's a whole nother currency, right? So we just don't, even our geography kind of informs our current situation, that we don't know a lot of languages. But that being said, the rest of the world is not like that. And a lot of the rest of the world, they are bilingual, trilingual. Dr. Lele, I know you know lots of languages, right? It's important, right? A lot. So language, I think is really important. It just gives you a whole portal to, I remember when I was studying Swahili, it's not just communication. It's like, it gives you a whole portal into a culture and to a people and what is important to the people. You get to an understanding just by, learning a language. What else would I say? I mean, I've said it earlier in my talk, and I would just say it again, that having conversations with people and having those informational interviews and starting to understand like what's out there is really important. So even if you know that you want to be in medicine or in health, there is a lot of avenues within health. So having conversations and connecting with people who are in that field, and it can be any kind of connection. Maybe it's like a family friend who knew you when you were in diapers, who actually works in the field that you're interested in, like reaching out to that person and asking them. People love to talk about themselves, right? So like getting a person to say, like, to talk about what they do, I think is pretty easy, but it's on you to like reach out and have that conversation and ask the questions. So those are 3 things. Yeah.
What are your thoughts? We have a lot of students that will ask us as advisors, should I go to grad school right after undergrad? Or should I take some time, to start a career and then go back to grad school? Do you have an opinion about that?
I've gotten that question a lot from students as well. And my response is that there's pros and cons to both. And I don't think there's a right answer. For me, I went to Susquehanna, I studied business and religion. And then I went to Uganda for 9 weeks. And I was like, oh, I want to do this, but I didn't know anything about it, So for me, it was the right decision to go straight to grad school. But there's a lot of people, program assistants, program analysts at USAID who don't have their master's. And what happens is they only have their undergraduate, but then they're able to actually like get that street knowledge, that street cred, start to build those networks. They're in USAID for maybe a year or 2 doing that kind of administrative kind of work. But then that helps inform what degree they go for, right? So like, at the end of my time at Pitt, I was like, oh, I could have gotten an MPH. And it's important to know that Pitt does have those joint degree programs, right? So you can get a degree from GSPIA and a degree, an MPH, in 3 years, unless they've changed that. But there was a program when I was there, at least, that you could get 2 master's degrees in 3 years. And a lot of people were doing that when I was there. Yeah, so I'm sorry, I lost track of what I was talking about. So yeah, there's pros and cons to going straight or taking some time. I didn't have the networks. I mean, and a lot of it's around privilege, honestly. Like, who has the money to just move to Washington, D.C. and get an unpaid internship? So actually, there's a lot of conversations right now about diversity, equity, inclusion, and accessibility. And at USAID, we are increasing opportunities for people from underrepresented groups. So the Payne Fellowship is a good example where, and it's for people from underrepresented groups at USAID, and you're kind of fast-tracked into being a foreign service officer. We're also increasing paid internships and trying to completely do away with unpaid internships because it's inequitable. It creates this dynamic where people who have money or who have parents who have money are able to, start the networking and get to DC because their parents can pay for their apartment, right? And some of that is still very much the current situation, but there's a lot of effort now, and there has been, to kind of end that system that perpetuates these inequities. I see a question from Alex. So what kind of internships are available? So the first link that I dropped in the chat is a USAID webpage that talks about different internships. Within global health, I'll tell you, if you go to that second link, the STAR, Sustaining Technical and Analytical Resources, that mechanism, they have internships open, I think, to undergrad and grad students. So there are internship possibilities. And I will say, I know a number of people who had an internship and it turned into a job. It turned into like a program assistant or program analyst. So that is an opportunity. I'm seeing questions roll in. Global health volunteering up. The number one opportunity for development to volunteer is Peace Corps. So if you go to Peace Corps, you get points, and you actually get to get into the front of the line when you apply to federal positions after your Peace Corps experience. So if you're interested in development, it's Peace Corps, and there's a ton of return Peace Corps volunteers at USAID. So Peace Corps does a lot of different things, not just health. So that's important to know. But that's one of those opportunities that you sign up, and you kind of sign up to go where they place you. And I'll say Peace Corps volunteers are just now starting to go back out to the field. They're actually going first to Zambia and to Dominican Republic. So I think they were on hiatus for the whole pandemic, and they're just now starting to come back. But other global health volunteering opportunities, I mean, another thing to note is, I know another resource I want to give you all. So I mentioned, this is .gov. I don't know if you can open this. Tell me if you can't open this. Maybe you can. But the other thing to know is you could work with on the implementing partner side. So for like APT Associates or GSPIA or FHI 360, the organizations that are actually doing the work, with local staff in these developing country contexts, they have volunteer opportunities. They have entry-level positions. So working, with the federal government on the donor side is only one part of the equation. Are you all able to open that link? Maybe not. Oh, you are? It's open? Cool. So this is new since I joined USAID. If you go to the user's guide mechanisms, you click on view mechanisms. This tells you where all of all centrally managed, so USAID Washington global health funds go. So this tells you all of the different projects that are getting funding. And what you can do is, so accelerating saving lives at birth. If you click on view mechanism, you should be able to see at the bottom, who is the partner? So you start to get a sense of like, what are the organizations that are working on issues that you're interested in? So this one is Duke University. So that means, they might have positions because they're actually, implementing this project. We are coming to the end of our time. So maybe I can take like one more question, or I don't know, Anna Maria, if you had other thoughts for how we close up.
Yeah, I agree. Is there any other question that you guys have for Caitlin before we close? These are such great resources,
And it's like, I didn't know any of it, right? And it's just like how things work and where to look. I got this information from an informational interview. So when I was unemployed, I connected with somebody from my undergrad, an alumni from my undergrad who works for USAID, and he gave me the Cameras website. And he's like, so this is one way that you can, so he didn't give me a job, but he told me where to start looking and where to start applying, right? So those informational interviews are so key for and it's all about the process and the journey. So if you don't focus on can you give me a job, that will not go well, but just, asking questions about, so what do you do? This is who I am. What do you think I could be doing? Yeah.
Mm-hmm.
Okay, I just want to piggyback on what Anna Maria said. This is so helpful. Your presentation has been really thorough and, incorporating public health or global health, development administration, how to approach looking for work. I really thank you so much. And thank you for allowing us to record it. At least we will have this for our students. I'm going to send it out to our professor who teaches Intro to Global Health, and there should be others like in GSPIA who would give extra credit just for listening to to listen, because it benefits them. But students sometimes need a little encouragement.
No, thank you. And kudos to every student who's on here, because to have that perspective that it's important for you to start thinking now about, what's out there. I think, it's awesome that you're doing that. Maybe one last note I'll leave you with is just, I am so proud to work for USAID within global health. So I'll tell you, we are working on the Global Vaccine Initiative, which is, Biden's commitment to help vaccinate the world and get vaccination coverage rates up to 70% by September 2022. Are we going to meet it? We'll see. But the fact that I'm able to engage and contribute my little piece to trying to, bring vaccination coverage up in Africa, and bring this pandemic to an end is just incredible. So I think I've drank the Kool-Aid of USAID. And I just, if you're at all interested in it, it is you know, I hear people complain about their jobs or like, is this really what I want to do from 9 to 5? And I can like very happily say that like, yeah, it's amazing that I am one little piece of this like mission, you know, so I'll leave you with that.
That's awesome.
Thank you.
Okay, before you close, if I may echo my colleagues, I want to say thank you so much, Caitlin. This was amazing. This was really a very informative session, and the confidence you exude in talking about your work, that's amazing. And we are definitely very proud of you, at least working in Africa and, you know, doing all that you're doing. Thank you. And hopefully, maybe when the world opens up again, we might invite you down here to just talk to our students. So thank you so much for your time, and thanks everyone for tuning in. Thank you.
Thanks, Dr. Lele. I would love to come to Pittsburgh. So yeah, let's talk.
Okay, great.
Bye, everybody.